TikTok to go up. All right, got people coming in right now. Got a good show for you guys. Got the therapy of the week this week, which is going to deal with those lovely locks on your head. If you're a girl or you're a guy, we can talk about what they are. And then I want to talk about CKD, chronic kidney disease, and make people more aware about this and maybe what to look for so they can see, hey, listen, am I good? Am I bad? Ben Greer, what's going on? What's going on, United Fit Model? How you guys doing? Everybody else has joined me in. So I've got some great information for you guys. So let's talk about therapy of the week right off the bat. So therapy of the week, by the way, welcome to Titan Talk Tuesday. I'm John. I'm your owner and CEO of Titan Medical Center, and I'm here to help you guys out, answer all your questions about everything that we do with Titan Medical Center. So anything that's going to make you guys look better, feel better, or perform better, Titan Medical Center has your back on. Nationwide service, so we can help you guys out wherever you guys are at. And it's real simple and easy to sign up. So everything from hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, peptide therapy, blood work, and everything in between. So if you guys have any questions about that, please shoot them out to me. If you guys want to become a patient or want more information about therapies and such, just call or text us at 727-389-3220, and we'll be able to help you out there. Our staff will be able to take care of you, make sure you're all taken care of. Big shout out to Big Drew. What's up, brother? Hope all is well. Brother from another mother, man. Hope all is good. So let's talk about the Titan Medical Ultimate Hair Health Package. So the Titan Medical Hair Health Package has three different things as far as what it has. Three different medication components. One, injectable biotin. Biotin is great for hair, skin, and nail health. It will absolutely be the best transportation rate you can get with this biotin, and probably the highest absorbency you're going to be able to get with the injection. Done with a little insulin needle. You can do it a couple times a week. This is going to be great. The next thing, our Titan Hair Health Capsules have a great combination of different things like DHT blockers and other things. They're going to help your hair, one, hopefully become healthier, more shinier, and help you keep your hair. So if you're losing hair right now or have high DHT levels, this will help balance that out. Also, our Titan Revitalizing Hair Foam. This one is great. Minoxidil, right? Finasteride, and Lantrapost. So it has three main medical components that you'll put in. It's a foam to help you keep your hair, grow your hair thicker, right? And just have better hair health altogether. So this will be able to do it. And you're hitting the body in three different ways, right? You're hitting by the injectable biotin, oral hair health capsule, and topically with our Titan Revitalizing Hair Foam. These are great things to do if you want better hair health. You want to keep your hair for a longer extent of time. This is going to be the way. If you want to make sure you're preventative and make sure you don't lose any hair, this could be your way too. Because there are a lot of people out there, when they talk about hair loss, they go down the path and like, why am I having hair loss at such an early age? And this could be genetics, right? If you have your father or mother, either one of their sides, your grandfather, great-grandfather down there, and genetic-wise, then you do have this in your genetics, like male pattern baldness, right? So at that point, this is something you need to really look for to make sure that you're good. And there are things out there to help you counteract or counterbalance some of these different things that could be happening to you, okay? Basie, how you doing? I hope all is well. So hair health. So at this point, you guys will get a discount. All you have to use is our Titan discount code, Titan Growth, and you guys can get the package. And at that point, you save some money. Who doesn't want to save some money on these great therapies? And like I said, for hair health. Michaela asked, what's the topic today, John? And the topics today are going to be our therapy of the week, which is our Titan Medical Ultimate Hair Health Package. And we're going to talk about CKD, living with chronic kidney disease. And I hope, I know some of you guys are out there like, well, I don't have to worry about my kidneys. My kidneys are good. I'm young and everything like that. I want you guys to know this information because you guys might find yourself in stage 1 or stage 2 of chronic kidney disease right now by your current EGFR and blood testing. So at that point, we'll go over that information too, so you guys know what to look for. I love to educate you guys, so you guys know when you guys maybe get your blood test or get a medication or whatever it is, you are educated about it. You know how it works, you know what to look for, and all these different things. So we're going to do that. How much is the discount? So I know you get $25 off any regular hair health capsule package. So I think we can give you $50 off this package. And if that's not the discount, you can say, John said, hey, listen, give me $50 off. So if they only try to give you 25, tell them John said to give me 50. And you can do that, Jerry, okay? Because I'm the owner, and I'll be like, you know what? I approved it. So if you were watching this live and you want the Titan Medical Ultimate Hair Health Package, injectable biotin, our hair health capsules, and our Titan Revitalizing Hair Foam, then you guys will get $50 off the complete package. Just say John said on his live, his Titan Talk Tuesday live, and you guys will be hooked up. All right? I appreciate you guys. As far as that goes, let's see if we got anything on TikTok here. Any questions over here? If you guys got any questions, shoot them out to me. I'd love to answer you guys' questions. It could be on any of our therapies or anything like that. Hold on. We got Michael Hearn live. Sorry, I'm on another live, Mike.
Call me after.
I'll call you right after, right? All right, see it. So just got off Michael Hearn. We're live for an hour and a half, and now we're live with you guys. I love it. All right, so let's talk about some different things. And if you guys want to talk about anything, like I said, from hormone replacement therapy, medical weight loss, vitamin amino acid injectables, rejuvenation detox, libido enhancers, peptides, blood work, everything's on the table. If you guys have any questions about anything else, please shoot them out to me. What are the primary risks for developing chronic kidney disease? Primary risks for developing. So dehydration is one of them. High blood pressure is another big one of it too, right? So we'll get into it. If you guys want to go into, there's no more questions, we'll go into the chronic kidney disease. So living with chronic kidney disease. Living with chronic kidney disease. I don't know why I'm having a problem saying that right now. All right, so when we talk about CKD, chronic kidney disease, this one really resonates with me and really hits home with me. And let me tell you why. One, I've lost a lot of friends to renal failure. So at that point, chronic kidney disease, and their kidneys give out on them, and they have to go on dialysis, and they can only stay on that for so long, and some of them die, right? So I've had this happen to a couple of my people that I know, some good people. The other thing, my dad. So my dad is in stage 4 of chronic kidney disease. I've seen his kidneys deteriorate through the last couple of years pretty bad. Right now, he's going through colorectal cancer, so he's getting chemo, and he's still in stage 4 chronic kidney disease. Well, they thought that he was going to have to possibly go on dialysis because his numbers were getting that low, and he hasn't yet. So that's a big positive, because once you start dialysis, you have to keep on dialysis unless you get a transplant of a new kidney. So just so you guys know that right up front. So when we talk about this, chronic kidney disease, how is chronic kidney disease diagnosed? It's usually through a blood test. Usually through a blood test, you'll look and they'll see your BUN, your creatinine level, and your EGFR level. And at that point, when they look at the EGFR, your EGFR is estimated glomerular filtration rate. That's what it stands for. And it's a measurement of how well your kidneys are cleaning your blood. It usually estimated from a result of a blood test along with age and gender. So when we start talking about this, that is the way that they look at it and diagnose it. Now, what can affect your kidneys, and how can you make your kidney levels possibly look better on blood tests? Well, kidneys usually look a lot worse if you worked out the day before, or if you've been very dehydrated or you are dehydrated. These will make your levels look really, really bad. So you want to always look at these levels, and if these levels are off on one blood test, don't freak out right away. Go drink a lot of water, don't work out the day before, and then repeat the test a week later. See where they come back. If it comes back the same, then hey, listen, you need to look at it and possibly fix the problem. If it comes back and it's a lot better, then it's just dehydration. You have really no problem. You just got to make sure you hydrate a lot better going forward. So these are different things. What dietary changes are recommended for someone that has chronic kidney disease? Great question. And it actually has this. So I have this posted on here so you guys can see it. And this has the things that you should eat, they recommend, and I still question. I'm just being honest with you guys. I really question this. Foods to choose for chronic kidney disease: bread, cereal, grains, pasta, quinoa, rice, apples, berries, pears, pineapples, plums, watermelons, asparagus, broccoli, carrots, corn, lettuce, squash, coffee, lemonade, soda, club or lemon lime, questionable, tea and water, then proteins, beans, beef, eggs, fish, lentils, poultry, and tofu. So these are some of the different things you can do. Hi, Katerina. How you doing? Hope all's well. With this, so let's go back to the stages. Then we'll get back to the food. So when we talk about the 5 stages, stage 1, evidence of kidney disease with normal kidney function, 90 through 120. Okay? So if you come back in EGFR at 90 through 120, you're in stage 1. And that's evidence of kidney disease with normal kidney function. So the kidneys haven't been damaged, but there's evidence here that there could be possible problems coming on. The next one, stage 2, mild to moderate loss of kidney functions. EGFR of 60 to 89. So stage 2. So if you get your blood test back and you look, and usually a CMP, a comprehensive metabolic panel, is ran on every blood test for you through any kind of doctor. And a comprehensive metabolic panel will also tell you your kidneys and liver function levels. So just know that. Stage 3, moderate to severe loss of kidney function, 30 through 59. Stage 4, severe loss of kidney function, 15 through 29. This is where my dad lies, right in between here. Stage 5, end stage of renal disease, kidney failure and the need of dialysis or transplant, EGFR of less than 15. Very scary stuff when you start seeing your EGFR go below 59, just being honest with you. Stage 3, I'd be worried. I'd be like, oh, you know what? This is not good. I better start changing, and hopefully I can, keep this leveled out to where it's at and not get any worse. But you really want to look at this and really make sure, one, you're hydrating, because that's one of the biggest things. That and blood pressure. Spiked blood pressure and sugar levels, direct effect on renal functions and can directly harm or beat down your renal, which is your kidney, functions. So at that point, you want to make sure you take care of it, especially blood pressure. And that's the biggest one that goes unchecked usually, that and sugar levels, because people really don't check their blood pressure. If they go to the doctor once in a while, they see it. If it's high, they really don't do anything about it. Maybe a doctor might see that and then put them on blood pressure medication, which will actually probably save your kidneys. There could be other negative side effects with the blood pressure medication, but it could save your kidneys. So got to look at risk versus reward and what's going to work the best for you. What treatment options are available for advanced chronic kidney disease? Great question. So advanced chronic kidney disease, let's say we're in stage 4. There is no treatment options. They have some different medications that hit the market that are supposed to help the kidney stay where it's at, but there's nothing out there that revitalizes the kidney. The only thing that would revitalize a kidney is another kidney. And then the next question I get is, well, don't we have 2 kidneys, John? So if one kidney goes bad, doesn't the other one work properly? You would think that, but the problem is the kidneys work together. And at that point, if one's bad, the other one's bad. Now, can you live off one kidney if you got just a transplant from somebody? Yes, you can, right? So you are able to be alive with one kidney that works properly. So, you could do that. But the other thing about it is that they need to know if their kidneys are good or bad. So at that point, a blood test is going to tell you right away. What are the common complications associated with chronic kidney disease? There's a lot of different things. You feel more fatigued. You lose a lot of weight. There could be stomach issues. All kinds of different problems. So, and then obviously, listen, you don't want your kidneys to get too bad because you're going dialysis, which means you have to go to a center and you have to get stuck for 3 hours with a huge needle that's basically recycling your blood. Now, there are home treatments you can do too as well, but they're not easy treatments to do, right? So you don't want to get to this level. So the whole point of this is to be preventative. Drink a lot of water. Make sure you're monitoring your blood pressure, and that's good. And make sure you're having a good diet too. That's the next thing that I want to roll down to. It says your body processes things differently with CKD, chronic kidney disease. Committing to kidney-friendly eating can help you feel better and stay healthier. Your nephrologist can talk you through your goals in eating and drinking and recommend a renal dietitian to help you guide. But some of these different things. So when we talk about bread, cereals, grains, pastas, I don't know what to say. At that point, those are going to turn to sugars possibly, and that could possibly affect you negatively. Also, when we talk about soda, I don't like any kind of soda. I don't care. Lemon, lime, whatever it is. Carbohydrate drinks, I would stay away from. The other one on here says coffee. Coffee can be a good one. I know they tell you to stay away from stimulants like caffeine and such, but coffee does have it. So this could be a natural thing for you to maybe help you out with some energy and to incorporate into your diet. That's the only other ones. I have a big one. The other one is protein. It says beef. So usually with kidneys and stuff like that, they tell you do not eat a lot of red meat, do not eat beef. I've seen both studies, right? And they're contradicting. Like one says it's good to eat it, one says it's not. So it really is how your body's processing and what's going down, all right? How does the CKD affect overall health? It affects overall health in a big way. This could be the difference between living, dying, feeling good per day and not feeling good the next day. So, I mean, with this recycling your blood and stuff like that, like it's a big factor. If it can't recycle your blood properly, then you're not going to feel good and you're going to feel bad. And if it goes unchecked for too long and you get to stage 5, you are not going to be a happy camper. And hopefully you have somebody you can get a transplant from. Because even if you get on the transplant list, it takes some time. And depending on how old you are or what health condition you're in when you get on that transplant list is how long it could take you too as well. So there's a lot of different factors that go along with this. And I really want to bring this information up because I think people need to know stuff like this. I don't think people are aware of this or they don't take it serious unless they're in stage 4, stage 5. Don't get to that point. Be preventative. If you see your kidney levels start taking a dive, you need to look deeper and see what's going on. Just don't shoo it away. So that's really what I want to leave on. I want to leave on that. I think that's a good level to leave on. I think chronic kidney disease and stuff like that is a good one. What are the challenges in diagnosing and treating rare genetic disorders? A lot of challenges. I mean, we don't do that, so I couldn't tell you all the challenges, but I mean, it's quite a bit. When you're diagnosing and treating rare genetic disorders, I mean, there's tons of information, tons of testing. I mean, patient getting frustrated. I mean, there's all different types of things. So that's it, guys. I'm going to leave it on that level. I appreciate you guys. Live healthier. That's the one thing I want to get across to you guys. Live the Titan lifestyle, right? Eat good. Get some activity. Sleep. Drink water. 4 basic essentials for the Titan lifestyle. And then if you need Titan's help on any of our therapies, we're here for you guys. Call or text us, 727-389-3220. Our ultimate hair health package, injectable biotin, hair health capsules, and our Titan revitalizing hair foam are the therapy of the week. Take advantage of the discount, $50 off the whole package. Rue, thank you. I appreciate it. Looking great. Thank you so much. I appreciate all you guys for tuning in. I'm going to go. Time to go get my workout in and go get stronger and look better, hopefully, and feel better. How does the medical center manage patients' flow during peak hours? Wow, that's a good question. Matt Nickel, how does the medical center, how do we manage patients' flow during peak hours? We have enough staff. We have good staff. We know our information. We know our stuff. And that's how we get through it. We get through it with teamwork. It's all about teamwork. If you don't have the team working together, you're not going to be doing good, I promise you. So that's how we do it. I don't know if it's a secret or magic or whatever we do here, but we definitely do it. So that's it, guys. I appreciate all you guys joining me. I'll be back next Tuesday with Titan Talk Tuesday with me, John, CEO of Titan Medical Center. I appreciate all you guys, love all you guys, and I appreciate all your support. I'll be back with you guys. If you guys have any questions, concerns, call or text us, 727-389-3220. Yes, you have good staff. Thanks, Matt. I appreciate it, man. I mean, listen, it gets really busy on the phone. I ain't going to lie. I mean, the phones are just cranking. So at that point, when they are doing that, it's, but we don't let them go. Like, we got to get to the phone. We got to make sure we're taking care of our patients. We don't know if you're an ordering patient, a patient has a problem, or maybe a reaction, or whatever, right? We want to make sure that we're servicing our patients. You guys are Titan family. We want to make sure you guys are taken care of, and you guys are getting the best optimal result. So that's it. If you guys have any questions, DM me, call, text us, whatever you want to do. I appreciate you guys. I'll see you guys next Tuesday. Titan Talk Tuesday with me, John, CEO, and